My name's Angie, and what brought me to Mackenzie Health is an illness that my mother went through and did not survive. We didn't come in knowing it was the end. She had been ill. She'd been diagnosed with stage 4 metastatic colon cancer in October of 2015. We were starting her on an immune therapy rather than chemotherapy. It was very hard because she did not tolerate any of the chemo or anything very well. It just wasn't good for her body. But she was a trooper. She went on, and standing at the kitchen sink, her hip broke because of the metastases. When we got to emerge, she was in a lot of pain, as you can imagine, and not moving at all on the stretcher, and they had to, get her to radiation. And emerge here is packed at all times, and this was a Friday. Late in the afternoon, and we were, standing room only in the middle of the corridor, her on a stretcher. So when we got the diagnosis of what it was, again, it was just one more thing that we had to deal with. It just seemed every corner we turned with her, there was another complication thrown in. And I had asked the nurse, because we knew we were in for a long night, and I said to her, she's been sick for 14 months. We've had a really awful time with complications. We've been in and out of hospital, a lot of wait times, a lot of pain. Is there anywhere you can put us that we're not in a corridor until orthopedics can see her? And so the nurse found a small room kind of in a ward area of emerge with a door on it, and that's where they brought us. So that was the start of, wow, they really showed some compassion here for this poor woman who has been through the ringer in 14 months. We finally decided on a week before she passed that palliative was looking like the only choice that we were going to have left. She was not going to get to rehab. She was starting to fail. She had a kidney infection, her body was starting to say, that's it, I cannot do this anymore. The problem was, palliative had a waiting list. We needed, as a family, to have her alone. We couldn't be in a room where family members of the other person were, joking and you're talking about the surgery, and they're boisterous, and it's not their fault. That's just, we were not in the right place for her. And palliative was full, and the hospital was full, and hospice wasn't an option yet because she wasn't that close. Well, the coordinator on the 4th floor and the chaplain moved mountains, like mountains. They finally found her a private room very close to rehab, so kind of between rehab and palliative. And it looked onto the parking lot, it had sun in it, and we moved her there about 5 or 6 days before she passed. She was unresponsive at that time. And when we got moved down to that room, the nurse there, when we came in, she greeted us, she reassured us she'd had experience in palliative. She told us about all the medications that they were going to be administering. She gave us a brochure on what to expect. Palliative visited her, because it was side by side. Every morning, whenever we needed any information, they were always there for us, always answered questions, phoned me. One of the palliative care doctors would be calling me regularly to give me updates on what she was finding. I mean, they don't have a crystal ball, so they can't tell you everything. But they tried to give us as much information as they possibly could. And again, that was something we weren't used to. We had a very positive experience in spite of the outcome, which was inevitable. And I felt like I could talk about it and share it with people, because everybody in this hospital made a very difficult stage in life a little easier.